Okay, perfect. Okay, thank you very much. So next we will watch a short video, and this video is on the Ubuntu Wellness Center's Diabetes Reversal Challenge, which was analyzed in this case study. This video is publicly available on their website, and we will also link that video in the chat.
Sound is muted.
Nanine, I think you need to unmute on your side, please.
Start from the beginning again, if you can.
Okay, let's try that again.
It was the 2nd of January, exactly after New Year. I started to feel weak and losing lots of weight. So I went to the clinic, and that's where I got that diabetic, and it was high. The doctors at my local clinic, they want to see me twice a month because it was bad. They put me on metformin 500. They raised the dose on the second appointment to the 850.
My original diabetic journey was take a whole lot of meds and then getting to understand, and through research, understanding that I had to change my diet. And by changing my diet, losing some weight, exercising, get off the medicine and manage it through diet and exercise.
When I studied medicine, once you're labeled as a type 2 diabetic or hypertension, it was for life. Now there's sufficient evidence to show that's not the case. And if one addresses your nourishment to health, you can reverse these illnesses.
I remember one day, Ian was chatting with me, asking me how's the life. Then I said, no, I'm fine, but I only discovered that I'm diabetic. And he asked me if I want to join the program to reverse the diabetic, because I was clueless about that. I just said yes, but deep down in my heart, I know I'm not going to do that, because I know my sister has been several years with diabetic. No one ever told us about the reversal of diabetes.
What we're going to try and do in 3 weeks is move your health along so that your metformin can be potentially 0.
How?
We're going to use the medicinal food.
The special diet or what?
Yes, the dietary intervention. So the medicine is food.
At the end of the day, we're trying to get my blood sugars under control with less medication, if not all the medication. And so for me, that's the really exciting part.
To be honest, I thought it won't work because it was only food, no medication. Because when Ian said to me, we're going to reverse the program for 2020, I think if there's some special medication, I'm going to be on it. But because it's only food, and I have, Ian gave me the book of reversal of 2020, then I read that book from first chapter to the last chapter. Then it helps me a lot also.
I mean, initially I dropped the first of the 3 medications that I was taking, so then I was only on 2. And then, so I still kept to the metformin or the glucophage, and I haven't changed that yet, but I've dropped the first one, the diglyceride. And then what I've done is I've started reducing my insulin intake, which is a once a day. I was on 18 units, and I'm now down to 8 units a day. And with that, my sugar levels are coming down. So my long-term homocysteine level at the start was sitting at 6 0.8 and I'm now at 6.2.
This is hungry.
Excellent. So you're also doing this? Very good.
She's 2 days before you. So she started on the Friday when you started on the Wednesday. And she's already managed to drop 50% of her.
Also, Dr. Red.
Every time I have good news, I want to share. As I was taking only 500 milligrams of metformin, yesterday, when was my day 15, Dr. Marina said I can drop again to 250 milligrams. Meaning I dropped 87.5% of the total of my medication. I can't believe in me, I don't believe. 5 days, I'm so happy. I'm so happy. Ian asked me the other night do I take some exercises, then I say no, because I can walk long distances. There's only one person sharing all my problems with his ovario. Then I say, ovario, maybe when you go to the gym, can you go with me? Then say, yes, I will assist you and I will support you. Then we started to take some exercises there by the cemetery. On the 19th day of my program, the doctor said I can go totally off of medication, meaning I'm diabetic free. I reversed my diabetic. Not only the family, even my neighbors was also surprised. Not only my family, my church members, the people on the street, when they saw my status on my WhatsApp, everyone, they want to know how did I make it. So now there are a lot of people who wants me to help, but I don't know how I can help them. And I think tomorrow when I met Ian, I will tell him also about this. Maybe we'll have a plan.
So I've been actually now longer than 21 days on a vegan, no oil at all diet to reverse my diabetes. It's a program that is run through Ubuntu here in Cape Town, but also linked through the Northwest University as a study here in South Africa on reversing diabetes. But it's also the work from Dr. Shah from India, and also there's a doctor from America that's also involved in this program. And when I started 21 days ago, I used to be on 3 different diabetic medicines, and I've now got rid of all of them. So it's quite amazing.
Thank you very much, Nanine. I'm now pleased to introduce Professor Andrew Robinson, who is the Director at Pan South Africa and the primary investigator of this publication. Professor Andrew Robinson, please can you share a bit about Pan South Africa?
Thank you, Pierre, and good evening, everyone. And you're also welcome to this webinar and for joining. I see, apart from international guests, which is amazing, we've got attendees from most of our provinces. I'd like to know if we've got all our provinces covered, and it's really important knowing that, to see how this important piece of research is communicated. On behalf of the participants who took part in the study and allowed us to share the data, and their journey was quite remarkable for me to see in my more than 40 years of clinical experience. I think all of us here are aware of the rapidly increasing incidences and prevalences of type 2 diabetes, not only in South Africa, but but globally. And nutrition plays a very important role in the management of diabetes. And that's also recognizing the importance of lifestyle diseases, such as adequate sleep, management of stress, exercise, etc. So but without addressing nutrition, it's unlikely to have or to be able to witness such clinical responses to a dietary intervention. And the study, we started and got approval just before COVID. And then you could see that the study, the intervention, which Ian McFarlane from Ubuntu and the Cape Town MediSpa, the intervention of the 21-day whole food plant-based diet and using food as medicine for that time. And the study was, our study was designed retrospectively to examine those participants and people who took part in the study. But as a background, PAN South Africa is part of an international organization based in Europe. And the main objectives of PAN are to educate health professionals, including students. And within South Africa, we are doing it, for example, tonight's webinar is an example of sharing information that is relevant and current to South Africa. We do have CPD journal clubs and university groups that are responding to a survey we did showing that more than 70% of South African students recognize that they need to learn more about nutrition. We also try and engage externally in the policy arena, and that we're doing involved with the food-based dietary guidelines and other similar organizations. So the study is important. It's a real beacon. It shines the light on the path that South Africa will need to take in order to address the pandemic of diabetes, type 2 diabetes, and along with it, all the other non-communicable diseases. But nutrition is a complex subject. It is highly contested into what are the appropriate nutritional guidelines to follow. And nutrition is particular and personal to each individual. So if there are 8 billion people on our planet, there could be 8 billion variations of nutritional interventions that are specific for that person, whether they be an infant, a lactating mother, a sick person, etc., etc. So, but along with all of those, I think there's general agreement that the importance of whole food, plant-based, minimally processed diet to follow is important. So just once again, thanks to all of you for joining, and particularly to the participants for sharing their experience, which we could study and reflect. And the study will be gone through in quite a lot of detail by Dr. Wyma, who will speak on the methodology and its limitations. But its importance is that for me, to get the study published in a peer review environment, it had to follow certain prescripts. But speaking from my personal experience, I've never seen any intervention, therapeutic intervention, as powerful as the 21-day whole food, plant-based, low-fat diet intervention. 2 of the participants to this day are still off their medication. All of them experienced benefits, and there's not one diabetic pill that has such a dramatic effect. So the importance is how to implement this within the South African system. The study has, and similar studies have been done in Europe and America, but because this is based in South Africa, it shows it can be done here. And small interventions, the Western Cape on Wellness Group, started by Prof. Frederick Maria, encompasses means and sustainable and regenerative means in which these lifestyle changes can happen within impoverished and disadvantaged communities. So I'm looking forward to hearing the presentation again, and to our guests, thank Christi and Dr. Patrick for theirs. So thank you, Pierre, and good evening.
Thank you, Prof, for that introduction. Next, we will have Dr. Patrick Ngassa Piotie, co-founder of the University of Pretoria's Diabetes Research Center, chairperson of the Diabetes Alliance South Africa, and the convener of the South African Diabetes Summit. Dr. Patrick Ngassa Piotie, please tell us how important it is to investigate and manage type 2 diabetes in South Africa.
Thank you for your kind introduction, Pierre, and good evening to all the participants. I'm sharing my screen. I've prepared a few slides to take us through to help answer that question that you asked. Can we see the screen?
Yes.
I'm trying to put it in full mode. Okay. Yeah, thanks again for the opportunity, and it's a pleasure to join you guys and to have this important conversation. I must say I'm not very familiar with the field, but having read, perused the article and having watched now the video, I can see it's interesting and quite promising. And obviously, as long as it's helping the people living with diabetes, then I think it's something to be excited about. So in terms of the scope, or why is it important to intervene when it comes to diabetes, we have the Lancet. For those who don't know, the Lancet is one of the most revered publication in this scientific space. And recently they released an article that says that diabetes will be a defining disease in the 21st century. And basically it says that how the health community deal with diabetes in the next 2 decades will shape population health and life expectancy in the next, for the next 80 years. Basically, diabetes is now in the 21st century what HIV has been in the previous years. And it's important for us, and as communities, as scientists, as people, to really take note of that so that we can intervene adequately. But why is it that diabetes is presented as a defining disease of the 21st century? In Africa, you can see that it's estimated that about 24 million adults have diabetes, and that is predicted to increase by 129% by 2045. So this is quite concerning. In Africa, 1 out of 2 people with diabetes are undiagnosed, and we can see already that in 2021, more than 400,000 people died because of diabetes. In South Africa, the picture is similar in magnitude, in the sense that these estimates put South Africa at about 4.2 million adults living with the condition in 2022, estimated to increase to 7.5 million by 2045. In South Africa, we can say that diabetes is the #1 cause of death among women, and the second beyond tuberculosis when you combine men and women. So it's really becoming quite a crisis. Over the past 10 years, the number of diabetes deaths have basically doubled. When you observe the other trends, you can see that most of the deaths from HIV and other conditions are decreasing, but for diabetes, it keeps increasing. Diabetes South Africa is, as I mentioned, characterized by an increasing mortality. Unfortunately, the research have found that management of diabetes in the both public and private sector is suboptimal. It is not good at all. And that comes with an emotional and physical financial burden on the person living with diabetes, but as well as the family. And as we can see in the next slide, the economy of the country is also affected by this increasing rise of diabetes in the country. This study looked at the expenses related to diabetes in the public sector. And you can see that in 2018, the expenses were estimated at 2.7 billion rand. But when you do a calculation and you try to estimate what if all those people who are undiagnosed were receiving medical care for diabetes, that would have put the expenses at about 21.8 billion rand, which is 12% of our national health budget. So you can see already the magnitude of the condition. And there is a lot that needs to be done to find the people who are not diagnosed, and the interventions, as it is even presented here, are really based on basic drugs. We're not even talking about the state of the heart in terms of technology and drugs that can help for diabetes. So those, at that basic level already, we could have been looking at 21.8 billion rand expenditure for diabetes alone. When they zoom in deep, they did an estimation in what those costs could look like in 2030. We will be sitting at 35.1. But what I want to draw attention on this slide is that 51% of the costs are just attributable to management. And out of that, 49% of those costs will be attributable to complications. So basically, it means that not only our rates of complication are very high, but if we continue with that trend, if nothing is done in terms of prevention, in terms of improvement of cure and management, we will be sitting at high costs just for complications. For those who are not familiar, the complication when it comes to diabetes, we are talking about lower limb amputations, we're talking about blindness or losing sight, we're talking about cardiovascular complications, kidney failures, and so on. For example, once somebody reach end kidney disease stage, he or she will need to receive a dialysis. And those are really costly procedures. That's why probably you can see in these estimates, 49% of the cost will be simply managing complications. And as I said, it's quite high. When you look at the cascade of care for diabetes, just to reemphasize or to reinforce the point that we really need to intervene, it is estimated that, as I said, only half of the people who have diabetes are diagnosed, only 38% of those diagnosed receive treatment, and only 19% of those who receive treatment are controlled. And you can imagine, again, this is very low numbers. That means that 81% of the population living with diabetes is not controlled and obviously exposed to the complications. The Department of Health, just in conclusion, has reacted to this crisis and released the National Strategic Plan for the Prevention and Control of Non-Communicable Diseases. For the first time in South Africa, we have specific targets for diabetes and hypertension, the 1960-50. So based on, according to those targets, 90% of those who are living with diabetes or hypertension should be diagnosed. That's quite ambitious, moving from the 40% or the 50% where we're sitting at the moment. 60% of them should receive an intervention and 50% should be controlled. Obviously, the estimates at the moment are that everything between 19 to 23% of the people receiving treatment in the system are controlled. So there's really a lot to do. And the goal of the department is really to leave no one behind. You can see what we're observing at the moment is only the visible side of the iceberg. There's really a lot to do. And I believe interventions like the one we'll be discussing this evening could maybe play a role in ensuring that no one is left behind. As Prof mentioned, one of the critical aspects of managing diabetes is the lifestyle modifications, but it's always a challenge when you talk about adopting healthy nutrition, healthy diet in the socioeconomic condition of the country. So it's really welcome that there's an intervention that look into it, and I might have found the solutions that will be suitable to the South African continent. Therefore, for us, in terms of meeting the target, really, we talk about partnership like this one that brought us together for this webinar, innovations, like what about trying this plant-based diet? And yeah, so I'm quite excited for the rest of the program. And if there's anything that we should keep as a take-home message from me, is that diabetes is increasing, it's affecting all families, all communities, and it's really up to all of us to intervene, whether by advocating for better care, whether by supporting the person living with diabetes, or keeping our government on their toes in terms of improving the management that they are giving to people with diabetes. Thank you very much.
Thank you very much, Dr. Piotie, for that really excellent overview of diabetes in South Africa. Next, we have joining us from Northwest University is Dr. Christi Niesing, Senior Lecturer at Author, Africa Unit for Transdisciplinary Research at the Faculty of Health Sciences. Dr. Christi Niesing, please tell us how important it is to research and publish research on health promotion in South Africa, and how does the Northwest University support this?
Thank you so much, Pierrette. Yeah, and thank you everybody for giving me the opportunity to speak to you today. It's quite an esteemed audience, and yeah, thank you for your time and attention. So I work for the Africa Unit for Transdisciplinary Health Research. That is author, spelled like that. We do not publish books there. We do that as well, but that's not our main purpose. So we're a transdisciplinary research unit focusing on health promotion. And we originated, in my next slide, I'll show you where we originated from, nutritional research. But what is a transdisciplinary approach that we apply? So it's very difficult to do true transdisciplinary research from the beginning to the end. So we talk about pockets of transdisciplinarity where everybody comes together to co-create. But the beauty of transdisciplinary research is that we focus on real life challenges, and specifically for our unit, it's health challenges, where we get academic partners, non-academic partners, community partners, and also industry together. We talk about the quadruple helix system. The concept was coined by Niculescu in 1980, but it has evolved. So there's basically three main schools of thought. And when doing transdisciplinary research or using a transdisciplinary approach to understand a problem, it is really important to know what transdisciplinarity means for your project or for your specific research focus. And we're the only research unit in South Africa, transdisciplinary unit, that focuses on health. The other units have other focus areas. So the main challenge when doing transdisciplinary research is the complexity of it, because you have to say that from your discipline, you're coming very strongly in from a specific discipline, but you're prepared to declare that you do not necessarily have the answer to the question from your own discipline, and that all types of knowledge is important, not only academic knowledge. And you go into a space of wanting to really understand, wanting to explore. It's an uncomfortable and a kind of a messy space that you go in. You have to be prepared to not have control over what you're doing. My research director, Prof. Petra Bester, always says we don't have controlled laboratories. The communities are our laboratories. And it's also not your normal academic career that you embark upon when you do transdisciplinary research, as it's a lot more difficult to complete these types of projects, and also it's changing, the arena's changing, but it is difficult to publish this type of research in your normal dissemination streams, and I'll also discuss that a bit later. The importance of transdisciplinarity comes in when we think about what Dr. Patrick has just presented to us, the changing world of health. HIV is really under control at this stage, but our health system suffers under the quadruple disease burden, and therefore we need to open up the dialogue between science and society, and we look at what we call wicked problems, because it's problems that's been around for many years, and as a lot of organizations and individuals spend a lot of money and knowledge and time on trying to solve it, but still we cannot get to a solution. So if we can understand a specific context and a specific part of a problem, that is what we want to do. So my next slide is just to give you background on author. So author actually originated from the TUSA study that was completed in 1998. And that study was mainly done on the food security status of rural farm working women in the Northwest Province. And it indicated that they didn't have food security at all. So one of the interventions that was implemented was to develop income-generating community projects. The academics made a huge assumption at that stage to assume that if you create an income for somebody that didn't have an income previously, that they will necessarily buy food, which was not the case. We actually induced alcoholism in one of the communities, and therefore our life plan program developed from that provides people with holistic knowledge and skills on how to cope with everyday challenges. So Life Plan is a registered short course, a 6-month short course for facilitators training. It has 3 modules. The first one is the personal development journey. The second one is how to become a responsible citizen. And the third one is facilitating healthy community dialogue. And that provides us with a platform to work with basic skills that are in a community then. So I started in 2008. I've been with this research unit now for 15 years. I never thought I would be in academia, never thought for 15 years. So that is actually scary. So our Life Plan program has been through 3 cycles, iterative cycles of redevelopment. So our Holding Hands income generating project, that was basically the inception of the FLAG program, the flagship program as well of author at that stage, became self-sustaining projects in 2016. And then in 2017, we received a community engagement grant from the NRF to formalize our platforms that we establish in communities that develops reciprocal relationships, and we'll get to that a bit later. 2018, we met up with Prof. Frederick Maree, that at that stage worked at the Western Cape Department of Health, through Prof. Andrew, and we replicated the Western Cape on Wellness program in the Northwest, and we called it Northwest on wellness. And just as we were starting to get traction for that, COVID happened, and where we usually had practical, physical interactions in communities, we then had to go virtual. So we developed our Ubuntu project that was a virtual platform. It still exists, where we share social media experiences. And then we developed for the Northwest University a system to monitor the impact of long-term community engagement interventions in communities. So I just quickly want to touch on this. So I'm a rebel in academia because I do not believe in the publish or perish process. I believe that it's important to do what PAN is doing tonight and to disseminate information, academic information, in other ways as well, so that we can actually make an impact, not only in academia. So our main approach to doing health promotion research with impact is to develop reciprocal relationships in communities. So we develop what we call research platforms with active community forums where we share knowledge, we share resources, and we co-create solutions for wicked problems. And then we developed our social greenhouse process. So this is what all our research and interventions is based on. It's influenced by our best practice and experience over the past 15 years, but also academic processes. We lean strongly on the intervention mapping process, but we do not agree that it's a linear process from beginning to end. Therefore, we have the roof and the foundation to monitor and evaluate sustainable impact. So the green block is where we really go in and understand the community, because Africa and South Africa is very contextual in nature. And we cannot just say that what works in the Western Cape will necessarily work in the Northwest Province. So we also work from a strength-based approach, because we firmly believe that there are assets available in a community, and then understand from the sustainable livelihood approach basis how these assets are managed within a community and accessed within a community. So you will see the roof already on top. The blue block is for monitoring and evaluation. So we collaboratively identify in the first phase indicators of what will be success for a specific project. And we record the data in such a way that we can see over time what the sustainable impact is. And we also try to measure the intended as well as the unintended impacts of interventions. So if we have a plan at the end of the green block, then we go into a process of actually testing this type of solution for a very specific community. And we go through iterative cycles of participative design, where we get feedback from the end user. That's why we also call it bridging the community technology gap, because sometimes we have very clever academics who thinks that they alone have the solution to a problem, but they don't understand the actual end user and the community. So if at the end of phase 2, we have something that works for a specific community, then we replicate it in another context. And that is what phase 3 is for. So I hope I gave you an overview of Author as a research unit. We have 2 master's degree programs that we present, as well as 2 PhD programs that we present. But we really love engaging with research projects like this one, where we really need to go and dig deep and get into that uncomfortable spaces to co-create a solution and then see what the impact of that is. So thank you very much for your time and listening to me, and back to you.
Thank you very much for your presentation, Christi. I think that was really a good overview of health promotion and the importance in research. So thank you very much for that. I would now like to invite Dr. Nanine Wyma from Pan South Africa, and she will now share the research findings from the study.
Thank you so much for the introduction and for our guests who have joined us today to share additional insights. It's great to see the support that we have, and we're very grateful for all the support that we've received at Pan South Africa and for this research from all of our panelists. So thank you very much for being here today and sharing your perspective and what you are working on at the moment. So now is time for us to get into the research, and here we go. My name is Dr. Nanine Wyma. I have a Bachelor of Medicine and Bachelor of Surgery, and also a Master in Health Science and Transdisciplinary Health Promotion from the Author Department at Northwest University. I'm also the co-founder and director at Pan South Africa. I was one of the researchers, and just ahead of my presentation, I don't have any conflicts of interest. So to start off this presentation, I thought it would be good to go all the way back to the beginning, and I dug out this photo from the archives of Pan South Africa. And this photo was actually taken at Pan South Africa's first ever strategy meeting, and that was at the end of 2020. So Pan South Africa was formed in the middle of 2020 during COVID, and we were able to have our first in-person strategy meeting at the end of the year. And this meeting actually took place at Ubuntu Wellness Institute in Cape Town. And here you can see the three directors from Pan, as well as Ian at the back, who led the Diabetes Reversal Challenge. So it's great to see where we came from, and the reason why I wanted to also bring this back is maybe to describe how the research unfolded and provide additional context to the decisions that we made that led up to this final publication at the end of the day. So it was during this meeting that we discussed what was Pan South Africa going to do, and what approach were we going to take, and what problems did we want to solve. So we identified a problem that the research into plant-based healthcare is largely based on populations in the global north, and this doesn't adequately represent South Africa, the diversity of South Africa, as well as our cultural and social conditions here in the country. So our solution was then to create a relevant local evidence base for plant-based South Africa in our country. And because we were a new organization, and this is also a novel concept, we had to do what you would refer to in medicine as start low and go slow in terms of resources. And that's why we ended up doing a more observational case study instead of a controlled clinical trial. And I hope that sheds light on some of the decisions and what was actually produced at the end of the day. So when we walked away from that meeting, we set up a research team, and the research team was made up of Professor Andrew Robinson here and I from Pan South Africa, and then also researchers from Author, including Dr. Niesing. And the study design that was decided upon was a multiple case study where we retrospectively explored the Diabetes Reversal Challenge led by Ubuntu. We received approval from Northwest University Ethics, and we also received gatekeeper permission from Ubuntu to access the participants of their challenge. And our funding for this was provided by the ProVeg Grants Department. They supply small grants for vegan advocacy all over the world. And the Grants Department also had no input on how we designed our study and how it unfolded, and also how we published the results. And now I'm going to start at the beginning, which is the case description. And this slide is a graphic which we have created to visually represent how the diabetes reversal challenge happened and how it was led. So we'll start at the beginning, which is at Ubuntu. This is a private wellness clinic in Cape Town. This was the famous tree at the back of Ubuntu, which I hope that some of you will be able to sit under one day, where we took the picture. And Ubuntu put together a team of a leader, project manager, nutritionist, and also some chefs, as well as a filmmaker who directed and created the video that you saw earlier. And Ian, who was the leader of the challenge, is actually here in this webinar today. So if you have any questions that maybe he could answer about how this challenge was implemented, I invite you to put that in the Q&A box. So they created the challenge, and they then recruited South Africans who were living with type 2 diabetes. There was no restriction placed on these participants in terms of comorbidities or the duration of diagnosis. And so they just recruited South Africans living with type 2 diabetes. And these individuals then accepted the challenge to eat a whole food plant-based diet for 21 days. And it is quite important to note that these participants were willing to change their lifestyle, and they were willing to improve their health. So they were already one step ahead on the behavior change cycle. And what Ubuntu provided them is, from the comfort of their own home, they were able to take the challenge, and they were provided with a recipe book, which is African inspired and developed by the chefs of the challenge. This recipe book is available for purchase, is now in exclusive books. And they also then connected these South Africans with a group of private physicians. And these private physicians collectively monitored the participants during the 21 days. They monitored them for any side effects or also any positive effects as well, recording that and changing the medication dosages and clinically monitoring the participants. And then all of these team members here, or all of these that were involved in the challenge, they were connected via a WhatsApp group. And here they were able to discuss with one another and receive additional support. Then once the 21 days was finished, the South Africans then ended up going back to their original healthcare system. Some were in private, some were in public healthcare, but the physicians who monitored the participants provided a note to say, this is what happened during the 21 days, this is the dietary approach, this is how the clinical profile changed, and these are how the medications may have been adjusted. So that is how the challenge happened. And we actually are going to be discussing what happened during this challenge during April 2021 and May 2022. So that's the snapshot in time that we are looking at. And now this slide summarizes the methodological approach that we took to exploring the diabetes reversal challenge. Case studies characteristically collect multiple sources of data to create a big picture of what happened and what unfolded. The multiple sources of data also are able to triangulate the information and validate the results. So for the data collection, we had an all-inclusive sample of the participants who had taken the challenge at the time, which as I said, was early 2022. And that amounted to 10 participants and 4 private physicians. So we first interviewed the participants, and we obtained additional informed consent to discuss their clinical case with the physician. And thereafter, we interviewed the physicians to understand the healthcare provider's perspective. And we retrospectively accessed their clinical records before, during, and after the challenge. And here we collected not only the case notes, but also the laboratory tests. And I've also added here the 2 other data sources, which we planned to collect, but regrettably did not have access, either we couldn't access it or it wasn't available. And the absence of these data sets actually limited our ability to comment on things like adherence during the challenge or the nutritional adequacy of the diet during the challenge. So that explains why there might be some unanswered questions. But with the mixture of the data that we did have, we took the interview information and we did a thematic analysis. And for all of the health claims that were provided, we attempted to validate them by doing a document analysis of the clinical records. And with all of that information together, we took all the cases and did a cross-case synthesis, which means we threw them all in one, and then presented the information within the socio-ecological model. And this is the socio-ecological model that we designed and published. I understand that it's not very easy to read now, but you can access it in high resolution online in the article. And a socio-ecological model is used to understand the complexities and multiple dimensions of influence over a circumstance or an intervention. So by using this model, we gather an understanding of the South African contextual factors, which may influence healthy plant-based eating behavior for type 2 diabetes. The model begins on an individual level. What happened? What was the participant's experience? And then it goes out into the close relationships of the participant, the organizational factors or the programmatic factors of the challenge and how it was implemented, then the broader South African socio-cultural context, the community, and finally we end off at the South African healthcare system. And from here onwards, I'm going to discuss the results of our challenge within these spheres and themes. And we start right at the beginning with the individual factors. So we looked at the motivations of the participants and we found that the participants were motivated to take this challenge. And a theme that emerged was that they were motivated to actually reduce the amount of medications they are taking. So we've heard that there are multiple medications and that there's a lot of expenditure that goes towards treatment. So this placed a burden on the participants and they wanted to relieve that burden. They didn't want to take medication anymore. And during the challenge, when their bodies were responding to the nutritional intervention and when they were experiencing their own health benefits, having that feedback of my health is improving, that was strengthening their motivation. So the most commonly described health benefits that they presented with was improved glycemic control or improved blood sugar control, reduced need for medication, weight loss, reduced abdominal circumference, and also psychological benefits. So what's important here is that we don't only see benefits for type 2 diabetes in terms of blood sugar control and medication, but also with other risk factors that can influence the risk profile for other chronic non-communicable diseases. So an overall improvement in metabolic profiles. And for all of these described health benefits, we did attempt to validate with clinical records. So the challenge with this was that we did access those records retrospectively. So we didn't have the opportunity to direct the physicians in how they should be monitoring their patients. And so it wasn't standardized when we did our retrospective data collection. And the instructions that the physicians received was to monitor the participants by a weekly HbA1c. So I'm sure that we can have a discussion about, reasons why physicians shouldn't be monitoring patients with weekly HbA1cs, but it was viewed by those who were leading the challenge to be the gold standard for blood sugar control, and that was the instruction that they were given. So that those HbA1cs before, during, and after the challenge are available in the published studies. We did find some other laboratory tests, such as the lipid profiles, and this was unfortunately weren't able to present those results because it was only for a few participants. So it's important to note here that improving glycemic control to the extent that the participant could reduce their medication and possibly eliminate their medication entirely was the primary motivator or outcome, desired outcome for Ubuntu during this challenge. And even though this wasn't recorded in the notes very often, this did come through in the interviews and the descriptions. So many of the participants reduced their medication, whether it was injectables or oral medication. And there were even some that described that they came off all medication or reducing medication every few days, or even just a reduction by 25%. So this was a persistent theme throughout the challenge. And as we move outward in the socio-ecological model, it's very understandable that a change in diet can impact your close relationships, particularly in the family unit. So we observed that in some cases, additional family members decided to support the participant by also taking a 21-day plant-based challenge. So this provided support, obviously, to the participant, but it also increased the scope of influence of the dietary challenge, which is a positive outcome. And in other cases, we did see that when family members resisted the diet, this led to barriers and challenges for the participant. So this leads us to believe that involving family members in these types of interventions can improve the outcomes. And on an organizational level, about the actual program and how it was implemented, it's important to note that this was a pilot project. So we looked at the first 10 participants that had ever taken the challenge. And some of the positives that the participants described about how they experienced the challenge was they really appreciated the continuous support, and they felt like they really needed that. And also they were supported by the inclusion of chefs within the program, and there were opportunities for cooking demonstrations with healthy food preparation methods. So that really did support some of the participants. And then interestingly, many described the first week out of the 3 weeks as the most challenging. So we have a doctor here describing that a few of the participants for 2 or 3 days experienced headaches, irritability, but all of them said from day 3 or 4 onwards, they started feeling better. So here we've identified where the most challenging part might be for the participants. And now we'll move on to some really interesting and unique findings, which is how did the challenge fit into the South African socio-cultural context specifically. And here we had some themes emerging around meat consumption in our cultural context of our country. So some participants actually described what we refer to as the nutrition transition in South Africa. And the nutrition transition is where, as a result of urbanization, and it documents a change in consumption patterns over time, where there's a shift away from traditional diets that are high in indigenous foods and occasional animal product consumption towards diets that are high in ready-made foods, processed foods, with very regular animal product consumption. So many of the participants said things like, my dad tells me we never used to eat meat as often as we do nowadays, or that their traditional diets aren't as high in meat, and that it's kind of a contemporary thing to consume as much meat. Yet there were other themes of how animal product consumption or how meat consumption is embedded in some African traditional and religious practices. So that shows us that animal product consumption has more value than just food and nutrition to people. There are other parts, there are other ways that consuming animals provides value. And it's not only about protein or etc. And then some other contextual factors about South Africa specifically is that there was a challenge in accessing particularly informal in the informal settlements in accessing a diversity of vegetables. So in some of the supermarkets, they describe that there's only 1, 2, 3 types of vegetables, maybe potatoes and cabbage. And if they wanted to access things like green beans, then they had to travel to a supermarket outside of town. And this adds an additional cost to the healthy diet. And so there were difficulties in accessing diversity of vegetables. And then on the other hand, also difficulty in accessing healthy plant-based meals and food services, like as in airlines or in hotels or in restaurants, wasn't widely available. And finally, this is a very important topic that we love to debate about the affordability of plant-based diets. And that is very fair to ask that question, especially with the rise of so many novel plant-based products out there. But what we found is the theme that we found was that when the diet was centered on whole foods and there were large swaps between meat and then whole food plant-based proteins, that it was more affordable. So in comparison to meat, beans are cheaper. So there was a theme that it was more affordable, that it was cheaper for them to eat this way in comparison to their previous diet. And the final theme that we have, wrapping up the socio-ecological model, is how did this fit into the South African public health system? So the first thing is that participants expressed consistent dissatisfaction with the nutrition support and education that they were receiving in the healthcare system, especially related to type 2 diabetes. They reported on fragmented and inconsistent nutrition information. For example, here we had a participant described that the day that they were diagnosed, they received 3 pieces of paper and that they contradicted each other. The one said, don't consume fruit juice. The other one said, do consume fruit juice. So the support that they were getting with regards to nutrition and type 2 diabetes was not adequate. And this is something that Dr. Piotie mentioned earlier as well, on the readiness of our healthcare system to respond to these types of diagnoses or to these lifestyle-related diseases. But a major takeaway that we had from the study, which we are obviously very pleased about, is that there was a general acceptance of the plant-based dietary program amongst the health professionals who were involved in the study, and also the wider community of health professionals that experienced the study. So one of the doctors said, it's been sort of a novel learning experience in terms of what a plant-based program can be. Just seeing what it can do in terms of chronic disease management, this was very powerful. And the other physicians, this is actually one quote from each of the physicians involved. So very happy with the plant-based diet. I'm more positive now than I was at the beginning about plant-based nutrition. And another doctor, the one doctor who actually said he already advises all of his patients on plant-based eating. So this positive attitude demonstrates that the healthcare community is ready for this type of information. And also something that was interesting was those clinic letters that were taken back to the clinic. And when a participant arrived back in their healthcare system and said, now I'm off my medication, there were the health professionals there actually wanted to learn more. They said they also have a husband who has diabetes. They really want to learn more about plant-based eating. So not only are the physicians ready for this information, but maybe that the broader healthcare providers are also ready for this information, and that they are actually wanting to receive this information. And this makes us very pleased, because this is the impact that Pan South Africa hopes to have. And now that we have discussed the results, it is also important for us to consider how we apply these results in the real world. And we should acknowledge that the clinical evidence that we have presented today is not strong enough to influence medical practice or influence any type of policy or guidelines. And also that the without the long-term follow-up, so the 3-month post check-in, we also cannot claim that any of the participants actually reverse their diabetes. So we don't have that data available. And also, with that said, the descriptions and the trends do point in a positive direction and deserve further investigation. And there is still even though the South African study might not be able to influence medical practice directly, there is a lot of evidence in other populations that and systematic reviews that look at plant-based nutrition for type 2 diabetes. So our progress in South Africa is just getting started, and I really do hope that there are people listening here today that are thinking to themselves, what is the next step, and how can we take this information and take it one step further, and how can we advance this, and where do we want to take this? So our conclusions are that there are multiple layers of contextual factors that influence real life healthy eating behaviors. We didn't have the opportunity to do a clinical trial where you take a participant and you hospitalize them and feed them breakfast, lunch, and dinner, knowing that it is perfectly vegan, but that isn't actually what it is like in the real world. In the real world, there are people out there who are eating from their own homes, preparing their own food, slipping up here and there. And this provides a snapshot of that kind of realistic type of scenario. And secondly, the evidence does support that there are positive health outcomes associated with plant-based eating for type 2 diabetes in South Africa, as well as metabolic risk profiles for further chronic non-communicable diseases. And finally, meat consumption is very much part of South African cultural practices. Despite the fact that our traditional diets are actually predominantly plant-based. And now is our opportunity for Q&A. We wanted to leave a lot of time for the opportunity to ask questions. I see all of our panelists are still here. I think Ian was also in the audience tonight. So we'd be really happy to answer your questions and to have a broader discussion, or whether you want to share your experiences as well on a personal, professional level. If you are going to require CPD points for this presentation, I invite you to scan this QR code with your cell phone and fill in our form for the CPD points. It is very important that you fill in that form properly, and then we will be able to award you CPD points. And we also have an opportunity here to donate to PAN. Today, we have a very generous donor who will be able to match all the donations. So if we want to advance the study and really pour more resources into this type of work, then please do donate to PAN and show us some support. And now I'm going to leave this up here for everybody to look at. And Pia, would you like to take over with some of the questions?
Yes, thank you very much. And thank you again for your presentation. So we do have a few questions in the chat. So I'm going to just look at them and then I will give it over to the panelists. So the first question we have is from Nadine. Can this plant-based diet be recommended for weight loss patients? How much weight on average did the subjects lose? So I think either you, Nanine, or Prof can answer that.
All right, I'd be happy to answer that question because I did work with the data set, and we were really disappointed that we couldn't present the weight outcomes, the outcomes in kilograms and abdominal circumference, because it was measured in 4 participants and all 4 participants lost weight. So, and obviously that this was not a controlled, we didn't control for other factors, but we did have some of the participants describing that they didn't make any other lifestyle changes. They were not exercising more, but they were still losing weight. So out of the sample of 4, they did lose weight. All of them did lose weight. And unfortunately, I hope that you can appreciate that a medical journal doesn't want to publish something of a sample of 4. So we would be happy to share those results privately.
Okay, Prof.
Thank you. Just to add, there was no restriction on the amount of calories or amount of food they ate, as long as it was low fat, whole food, plant-based and whole grains. So that simplified the process considerably.
Thank you, Prof. All right, so we'll move on to the next question. But before I do, I have noticed that some of you are struggling with the QR codes. We have put the link in the chat, so hopefully you can access it there. We do apologize for that. So the next question is from Kamini. Can you give an example of a day of a plant-based diet, please? Again, I'll give that to you, Nanine.
Sorry, I was actually testing the QR codes. So the question is, can you please give an example of a day of a plant-based diet? So the actual, I'm wondering if you're asking about this exact challenge or if you're asking about in general. I think that there are many guidelines that can share what your plant-based diet should be looking like. Generally, we do have a plate model, which says that half of your plate should be filled with fruits and vegetables. The other, and out of the other half, there's a quarter of whole grains and a quarter of plant proteins. So you do want to have a diverse and varied diet and kind of switch up what exactly you're putting in those quarters or halves every day. Luckily, a plant-based diet is extremely diverse. So I don't have the meal plan that the participants were actually eating, but from what I can remember, it was for breakfast, it was different types of porridges using not only oats, but other types of kind of whole grains or cereals. And then for lunch, it was lots of different types of salads, soups, stews, really emphasizing the whole foods. So I hope that answered your question.
Yeah, I think maybe if more clarity is needed, then that person can just let us know. Okay, moving on to the next question, another one from Nadine. So wanting to know what the costs were for this challenge or the costs involved. I think maybe Ian would be the best person to ask that question too.
Is Ian here? Is it possible, Ian, if you are here, we would love to see you, hear you. Maybe he did leave. All right. So the costs involved, as far as I know, the participants did not have to pay to partake in this challenge, to receive the private clinical monitoring, and also to access the recipe book. All of this actually happened free of charge, as far as I know.
Thank you. All right. The next one is from Betty. So great work. Just wondering if there is place for dietitians in this intervention. I see doctors and the chef involvement, but not the dietitian or the nutritionist.
Sure. So obviously, we find it extremely important to be working together with doctors and dietitians. And that is also what Dr. Niesing was saying earlier about transdisciplinarity and how sometimes it can be challenging for us to work together across disciplines, but it is also extremely important. So there was a nutritionist part of this challenge. The nutritionist is based at Ubuntu Wellness Institute, and she did form the nutrition support and provided the participants did say that they were very appreciative of the support that they received from her. So yeah, we would have liked to see a dietitian part of the challenge, but that was not the case.
Thank you. So I think Ian said he is here. He just is struggling to unmute. I think maybe you need to do it from your side.
Okay. I think just give me a second to look into that.
That's fine.
Okay, Ian, it should work now.
Hi, Nanine.
Hi, welcome.
Hello. Hi, everyone. Hello, everyone on the panel and the team from Pan and Northwest, all the viewers. That was an exceptional presentation. Thank you very much for sharing that, and really good to see after all these years, because it took quite a long time to go through all the rounds to get that out, but that's really quite remarkable, especially the socio-ecological modeling. And so just a big congratulations to all of you on the research side. And thank you.
Ian, would you like to share with us whether there were any costs involved for the participants?
Right. No, for the participants, that didn't bear any costs personally for any of them. We did have some sponsorship from some generous sponsorship from Karuna and Greenbaum Foundations to enable us to move forward with the project and to make sure the costs for the research side were taken care of, including the time of doctors and the time of the blood works and the testings. Pick and Pay was very generous in giving some food support, some initial food support for that first month in the form of those Feed the Nation community vouchers, and also helping us bring the book forward with the 80 recipes. So that was all sponsored as well. So for all those participants at that initial phase, there were no costs at all. And so it could be accessed by people of very different circumstances.
I think there's some clarity around the question of costing, so I'll just add to that. So Nadine's just saying that she would like to know how much it would cost to put the patient on this challenge. So the cost of the recipe book, who do we contact for patient follow-ups, etc., and where do we start?
Well, at this stage, we are unsponsored, but are getting interest from both private and public spaces to access the program. And currently we are doing some private programs of 10 people at a time, and the costing model varies according to the amount of support given. It does have a coaching component that is also quite time intensive. Some people also require food support, but as a minimum, and it can be done, privately, under care of one's own doctor in a very sort of relaxed way, just getting the book from exclusives. But if one was to get Ubuntu support for the 21-day program, that would be between 5,000 and 10,000 rand privately at this stage.
Thank you very much, Ian. Okay, so we'll move on to the next one from Bali. So she's asking, with the ongoing load shedding, how did the participants keep their produce fresh, and was there spoilage or issues with storage? So I don't know, Nanine or Ian, if you can answer that question.
So that's not something that we actually looked into during the challenge. As you can see, it was very, there were lots of different ways for us to evaluate the challenge, and we were focusing on health outcomes specifically. And those types of contextual factors, we actually did not have load shedding come up once in our discussions and in our interviews. So I would assume that perhaps that wasn't a major issue for them. Otherwise, they may have shared it with us, but it did not spontaneously come up. Prof, did you want to add to that?
Yeah, that's an important question, because if you think of the two options, if you think of animal products versus plant-based products in terms of refrigeration needs, when one goes into a supermarket, you can see how much refrigeration is needed for certain types of foods. And that can give you an indication of whole food, plant-based, doesn't require as much refrigeration. And for example, a kilogram of beans and a kilogram of meat, in terms of spoilage, then you can just see how possibly more robust it is in maintaining food supply when there is load shedding of healthy food.
Yeah.
Thank you.
Thanks, Prof. Okay, another one from Bali. Will there be research on the effects of type 1 diabetes, not for the reversal, but on having a low HbA1c? So
At the moment,
Sorry.
type 1 diabetes is just outside of the scope of what we are looking at the moment. We are focusing specifically on type 2 diabetes because type 1 diabetes is so unique and is also a autoimmune condition as opposed to a lifestyle condition.
In addition, internationally, they have shown benefits. So, as I said, we didn't test it within South Africa, but there is evidence in international peer-reviewed literature.
Thanks.
May I share quickly on that as well?
Go ahead, Ian.
Thank you. So when the documentary comes through, viewers, you'd be able to see a few more sort of characters, personal healing journeys being shared. And one of those is Naledi, who entered the program as a type 1 diabetic and, you know, has had remarkable support and progress in her case, including sort of vast reductions on her medication, but overall, very positive engagement with the process and has become her lifestyle now. And she wants to make her mission to connect with other diabetics, particularly type 1s, to benefit from plant-based lifestyles.
Thank you. Okay, so we have someone else asking a question here. Am I right, or do others agree that there are concerns regarding the nutrition or the nutrient sufficiency of a completely plant-based diet? Additionally, considering that a plant-based diet can lead to increased carbohydrate intake as well, thus guidelines on the specific diet would be important to study and communicate. Yeah, Nanine?
Sure, I'd love to answer that question. So it is absolutely correct that there are concerns for nutritional deficiencies or inadequacies of the more plant-based diet that there is. So the plant-based diets exist on a spectrum. Today we looked at vegan diets, and vegan diets are completely void of animal products. So there is an in-between in terms of vegetarian, pescatarian, and then all the way to vegan. And vegan does have the higher risk for nutritional inadequacies. That's why it's extremely important to work with a dietitian to cover things like iron, calcium, omega-3, vitamin B12 supplementation, which we refer to in the study, iodine. These are the major nutrients of concern, and it does take a little bit of extra planning and a little bit of extra creativity in order to cover those micronutrient requirements. The only one that is so much of a concern that you would require supplementation is vitamin B12. And it is a standard that everybody following a vegan diet should be taking vitamin B12 supplementation. With that said, a lot of other people also suffer from vitamin B12 deficiency. So it requires extra planning, extra skills, extra learning how to work with different types of ingredients, maybe have more of a diversity in your diet. And specifically with carbohydrates, you're correct that plant-based diets have a higher carbohydrate content, although we do look at the quality of carbohydrates that play a role. Not all carbohydrates are the enemy, and we would like to prioritize the good quality or higher quality carbohydrates in the plant-based diet.
Thanks, Nanine. Okay, so we have another question here. Does the recipe book provide additional support for users needing to count carbohydrates? Again, referring back to that, providing the grams of the carbs in the meal, as some might still need to balance their insulin with the meal.
So that is actually a bit more of a technical type of support that is required from a healthcare professional. I don't suggest that that you should be getting that support from things like recipe books. And I actually don't believe that the recipe book does go too deeply into that, although I do suggest that you can buy the recipe book. We are not the authors of the recipe book, so it's hard for us to answer those types of questions.
So, just to chip in and to add to what Dr. Nanine said about the types of carbs, processed carbs such as refined sugar and flours, all the grains that have been ground so they white and bleached, those carbs haven't got the complexity of structure to allow for the release, which doesn't cause spikes. And the programs used internationally don't restrict carbs as long as they are unrefined in all respects. And the instruction is eat as much of the correct whole foods as possible and take B12. So it's quite a simple instruction. And it's the carbohydrates are a very satisfying part of us feeling satiated, and have been the backbone of civilizations through the ages. If you think of South America, Peruvian potatoes in the north, the Mexicans with the corn, and in the east, the rice, and in Africa, the millets, Ethiopian grains. So carbohydrates has been fundamental to our civilizational development, and it's not particularly the enemy. And what is effective in this diet is the low fat aspect. So that needs to be looked at, and the roles that animal proteins are playing in the inflammatory process. So it's complex. Each person's got a specific, and as you say, certain people might require and do require those professionals to hold hands once they get stable. So important. It must be individualized.
Definitely. Thank you, Prof, for that. So there's a statement from Jacqueline. We require nutrition-sensitive diet, and that which is anti-inflammatory, as the plant-based diet is mostly anti-inflammatory. So there are also certain dairy foods that are anti-inflammatory. So I'm assuming that is the statement. I don't know if
I've unmuted you. So if you would like to make your statement, you are welcome to.
Good evening, everyone. Thank you very much for that, those excellent presentations. Yes, I've actually got a lot to say about diabetes. I do believe, I'll speak quickly. In South Africa, we have a lot of misinformation for years on end in terms of managing our patients. And a plant-based diet is excellent, but I do believe we need to have a look at the inflammatory components of the diets that the patients are currently ingesting, especially in prediabetes, because we know that inflammation plays a role in most new NCDs. And we also need to have a look at some of the other components that are anti-inflammatory, such as dairy products, and even the good old plate of mini meal combined with the legumes, which is also anti-inflammatory as well. So I don't agree with the fact that we need to lower our carbohydrates. It's just really going back to a diet whereby we include our legumes, and I think just the problem is that people don't know how to do it, and people haven't been informed on how to really ingest the foods that are going to be nutrition sensitive for their pocket as well, and their budget and their culture. And I just think we need an overall, a complete revamp of what we term, inverted commas, the diabetic diet. So yeah, that's a long statement to make, but I just think it's a lot of misinformation, lack of education, and I do think we need to focus on looking at anti-inflammatory components of the diet with a nutrition-sensitive approach? Thank you.
Thank you so much for making your statement. We really do appreciate hearing from those who are on the front lines and have been working with diabetic diets for a long time. And those are all very, very valid points. And it is such a complex case that we are working on. So thank you very much.
Thank you. Thank you so much.
Thank you. This is just a reminder for those that are sending questions in the chat. If you could please put it in the Q&A box, it will just be easier to see there. So the next question is, are there any plans in place for another study soon?
Great question. I see there's a few questions about another study. Are there any plans to roll out clinical trial to other provinces? Is there a plan to do a larger study to give statistical power? What is needed to implement this bigger study? Is this program scalable? Would like to know what research you have planned going forward. So I think that it is very clear that we need more research to be done. And we do believe that this type of research study that didn't require as much resources that a clinical trial does require does pave the way for further investigation. So what is required for a larger clinical trial is support, financial as well as institutional. So we hope that by disseminating these research findings, we'll be able to build those relationships and identify the stakeholders who are interested in actually taking this further, as well as identifying the funding sources, because it is no joke to take a retrospective case study and turn it into a clinical trial. It is a very expensive process, but it is also something that is not impossible and that can potentially make a very valuable contribution to people's lives and to the healthcare system. So it is something that we are going to be exploring during the next few months.
Just to add, it's as an example, Dr. Christie's program embedded with the community. Author has done, I think, a 15-year longitudinal study in a rural South African district. And with that database to put an intervention such as this to track people long-term. And it can be done nowadays very with the handheld or wristbands that can monitor people accurately. It can show and equate the impact and import of nutrition versus the pharmaceutical model and do the benefits and see long-term outcomes. So it's an important question, and it'll be quite cost intensive and resource intensive to do it properly. They're complicated. Nutrition research is, as you can see, is complex, and there's never an absolute linear answer. And all one can do is approximate what the reality shows. And I think we need the systems which have been implemented in the Northern Hemisphere and build on those and adapt them to our circumstance.
Thanks, Prof. So there's just a question here asking from Megan to please explain plant-based versus vegan.
Sure. So we like to refer to plant-based diets as being a type of umbrella term for the types of dietary patterns that emphasize plant-based food consumption to displace animal products in the diet. So there is a spectrum of plant-based diets. And on each end of the spectrum, say going from an omnivorous diet where there's plant-based food, animal-based food, dairy, then we can start by eliminating the meat from the diet. And then there's a pescatarian diet, which eliminates red meat and also chicken, but it only includes fish. And then there you can also remove fish and have dairy products and eggs, and that would be a vegetarian diet. And then if you completely remove animal products from a diet, such as there is no meat, there's no red meat, chicken, there's no fish, there's no dairy, there's no eggs, so no animal byproducts, which might also include hidden ingredients like gelatin and maybe bee products. That would be referred to as a vegan diet. But it's also important to know that the term veganism is an extension of the protection of animal rights. And a vegan diet is usually referred to as a part of a vegan lifestyle. So a vegan lifestyle aims to avoid any types of harm to animals, and thus it doesn't a vegan lifestyle doesn't include animal products in their cosmetics or animal testing on the cosmetics. Leather products include absolutely no vegan animal products in their diet, and that's where the term veganism comes from. But it has evolved into something a little bit bigger than that, also for health reasons. But in reality, plant-based diets are a spectrum, and there may be a few boxes on that spectrum, but you also don't have to fit into a box. There's also variations that are according to individual requirements.
Thanks, Nanine. All right, so we have another question here. Would it be incorrect to infer that if someone were to adhere to a strictly vegan diet, would this potentially lower the risk of developing type 2 diabetes?
Systematic reviews based on populations in the global north have shown that vegan diets are protective against type 2 diabetes. So according to the research, it does say that it prevents and protects against the development of type 2 diabetes.
Thank you. Prof?
Just to add to that, as Dr. Nanine described the range of diets, the life expectancy mirrors the amount of whole food plant-based, the proportion from total with 0 animal products to the various admixtures of those. So it does not only prevent, but it also it has been measured in terms of longevity.
Thank you, Prof. So I think this is more of a statement from Julie to say, I do feel that we need to be wary of using the term diabetes reversal, though I think it would be more appropriate to rather refer to diabetes remission.
So I'd like to touch on that, because this was definitely something that we considered during the challenge and during the study. So the term diabetes reversal was chosen by the organizers of the challenge, which was Ubuntu Wellness Institute. That was the term that they chose to rightfully name their own program. From our healthcare perspective, we use different terms like remission. And in order to achieve remission, we need to sustain normoglycemia without medications for 3 months. So we didn't have that kind of evidence to say that the participants went in remission, because we simply don't have the blood results and the feedback from the participants. Even if somebody with type 2 diabetes goes into remission, that doesn't mean that they cannot develop type 2 diabetes later. So there is a certain level of expectation management that needs to be done around the terms of remission and reversal, because it is true that not everybody who eats a plant-based diet for 21 days will go into remission. And that also doesn't mean that it will be sustained long term. So we agree with you, and we support that.
Thank you, Nanine. So we have a comment here from David Glass. Vegan diet can be unhealthy if it consists of refined food. That is why we like whole food plant-based.
Agreed. A vegan diet can consist of slap chips, deep fried food, processed foods, you can effectively eat a vegan diet by eating very unhealthy. So vegan is not synonymous with healthy. It's actually an animal rights movement and doesn't actually have anything to do with health. But over time, they did realize that the compassionate diet offered some metabolic health benefits. And that's where it started to become more of a health topic to study.
All right, so we have one from Nadine saying you spoke about vitamin B12 supplements, but what about iron and calcium? And I think I see Nadia actually put a nice little comment there in the chat. But yeah, Nanine, maybe you can answer that.
So if any of you would like a personal consultation, we can definitely recommend that you reach out to Nadia directly because of her experience managing patients that are eating a vegan diet. So please do, if you have any questions or would like support for your individual health conditions, message her privately. And the question was on iron and calcium. So there actually isn't the research shows that vegetarian populations don't have higher rates of iron deficiency anemia in comparison to omnivores. So I know that that is hard to believe in some cases. And there may be individuals, especially women of, adolescent women of childbearing age, that will have higher iron requirements, and there are other cases where you may have higher iron requirements. There are ways around increasing the bioavailability of the non-heme iron that you are ingesting on a plant-based diet, and that's why sometimes we say you would need to exercise a little bit of creativity in the kitchen to combine ingredients, to soak ingredients, to combine iron-rich plant foods with vitamin C. Those are some techniques that you can take. However, if you are experiencing iron deficiency, that would be an individual factor that would be individual for you to receive treatment for. But it's not a blanket statement to say that every single person should be supplementing. And with regards to calcium, it is possible to meet your calcium requirements on a plant-based diet. Also, just need to have more information on what contains calcium. Yeah.
Thanks, Nanine. So we have another comment and question from Megan, who's said that thanks for the reply, just explain the different plant-based diets. In South Africa, with the majority loving meat, what would you suggest? Because research versus practical implication needs to be considered. Nanine, are you there?
Hello, I can start with that.
Yeah, that's
just some overview about, can you hear me? Just some overview about the meat consumption, and it's in the last few decades, it's increased by 4 or 5 times. It's very heavily marketed, and most of the grains grown in South Africa go to support the meat industry. And most of them are monocrops, GMOs that require a lot of chemicals and biocides that do have a big impact on the environment. So just understand, and I think within the generation, as Dr. Nanine mentioned, there's been a big increase in the meat consumption, and a respect for the indigenous knowledge that has always been there within nutrition, and restoring some of that knowledge into practice and into the pride of an African diet, which is demonstrated in the Olympics so frequently by the East African long distance athletes who eat a very plant-rich diet and perform. So it is a complex process. And I think it is with the huge increase in the animal protein that has gone with the industrialization of agriculture that has put so much stress, and that period of that industrialization from the 70s, as if you track the incidence rates of the diabetes and non-communicable diseases, they started to climb from there. So that understanding and transitioning of those farmers into multiple plant-based producers is important. Someone also mentioned that the nutrient composition of vegetables hasn't got all the micronutrients that it used to have, and so that's why it's the part of the complex is into the regenerative agriculture that provides healthy foods near you that doesn't have to be transported. So it's something that needs to be addressed in a holistic way and shifted.
Thank you, Prof. So I think this is just a comment to say that the diet advocated for in the study does closely resemble the Mediterranean diet, just effectively excluding animal proteins. Okay, would this diet be contradicted for gestational diabetes?
It's not broadly contradicted for gestational diabetes, and that contraindicate but that is something that needs to be addressed directly with a dietitian and cannot be broadly stated.
Yeah, it's an individualized matter, the gestational, but it's definitely possible, and there's no health risks within normal parameters. I'm not talking about the exclusionary reasons.
I found a question in the chat. Any of the participants included in the challenge were perhaps of 65 years or older, and how did they respond in terms of adaptability, physiologically, practically, and clinically? I think this is I can see Prof also smiling, because we had an amazing participant who was based in a rural village, and she was definitely over 65 years. I think she was more towards 80 years old. Correct?
She loved it.
And
she loved it.
She was not at all fazed by this plant-based diet. She was like, they traditionally, her whole life, she's only ever eaten meat on Sundays. So for her to not eat meat on Sundays was not hard at all. And that was quite a refreshing response. And it also speaks to the point that we made about the nutrition transition, that the perspectives of elderly South Africans were more embracing of limiting meat consumption than, what we generally are used to these days. So she did amazing. She was healthy, and that was a really good, interesting case for us to see.
Yeah, she had difficulty when there was a church event such as a funeral, and people were worried that she wasn't eating the meat, and she used it as an opportunity to explain to them, but she didn't mind having a taste just to show that's not, but used it as an opportunity to teach and show by example. So she was wonderful. Mm-hmm.
Okay, thanks, Prof, for sharing that, Prof. There's a question here. How are you going to ensure that the participants remain on the diet long term?
So,
yeah. And if they do feel well and the benefit, and they carry on, and sometimes if they so-called lapse and do have a meat meal, they are more sensitive to the processes, and longer term the appetite for that is largely diminished. But sorry to interrupt you.
Yeah, but there was no long-term kind of intervention, especially not from our side. So from the case study perspective, we did not have any role to play in the implementation of the program. We were simply external viewers and reporters on the program. So that isn't kind of like the scope of how we participated in this specific project.
All right, I think
one more question in the chat, in the Q&A.
Yeah, so again from Megan, just saying, I'm a pescatarian for the last 30 years, normal weight, exercise, no diabetes, no heart disease. nothing, age 55. I am unsure if vegan is easily accepted or is it?
So I think
Right.
this is an interesting question. And I'm wondering what you mean by is it easily accepted? Because I did see your message in the chat as in, do I really have, so why vegan? And we are definitely not here today to convince everybody in the audience to go vegan. That's not what our intention is at all. What we are specifically, from a health perspective, exploring is the role of plant-based dietary patterns in chronic non-communicable diseases as a treatment option. And that is really our goal here. So we're not trying to turn everyone into a vegan, but more make it part of clinical practice. And so yes, contraindicated. I also thought so. So why vegan? And I think it's also important to acknowledge that there's many different reasons why people eat a plant-based diet. I've shared a little bit about animal rights and animal welfare concerns. And then there are also environmental concerns. So there is, evidence shows that food systems are very much connected with are leading drivers of climate change. This is also a major motivator why people eat a plant-based diet. And in that case, we know that beef and dairy are the leading drivers of environmental degradation. And that's why it's important to remain on a spectrum, for it to be okay to be somewhere on the spectrum. But specifically, we're looking at vegan diets for specific health conditions.
Just to add on the pescatarian issue, I was an avid fisherman, but if you consider where the fish are living, in the fresh waters, the current agricultural system have infiltrated almost all the fresh waters, so it's got the chemical pollutants, the microplastics, and in the ocean, the heavy metals. So no fish are free of those, and the fishing industry and globally, there's something like I heard 100,000 factory fishes on the ocean, and our seafoods are very depleted. I know one can eat responsibly and do that. The aquaculture, the fish farming has also big impacts, and they're now using GMO methods and gene editing in those fish. So there's a lot of environmental impacts on the whole process. But if one goes to the south coast of South Africa and there's the sardine run, and you think all these fish thrown up onto, who's it there for? It's, as you say, it's individualized, and if done responsibly is reasonable, as the Mediterranean diets have shown. Thanks.
And if you do want to learn about more about fish consumption, then and the kind of controversies around fish consumption, then I suggest you watch Seaspiracy. But watching any of these types of documentaries can be a little bit traumatic, so always keep that in mind. And with that, we have 1 minute left, so I'd like to take the opportunity to thank everyone. I'm so pleased to see that there are still so many participants who have stayed till the end to hear all about the program and to ask questions. We are so pleased to engage with you. Please do follow us on Instagram to get more information. You can sign up for our newsletter, and we also would love to hear from you. So we want to work together in order to shape this the future that we have, and to understand what the gaps are in your experience and what your needs are, so that we can fill those gaps with the support that we have. So thank you so much, everybody. And are there any last words from any of the panelists? No? All right. Well, thank you so much, everybody, for joining. We will be recording this and sending you the recording with our additional contact information. So please do get in touch if you have any questions, and have a great evening.
Thank you. Thank you, everyone, for joining.